Okay, well, just to reiterate, thanks very much indeed, and again, many congratulations on what you and the team have achieved to date. It really is very impressive, and the collaborations, for example, with the police reflects extraordinarily well on both organisations. There is no magic bullet, and what I'm going to say is based on the UK experience, and that many of these may not be relevant to India. I think one has to look at other countries, learn from them, but application has got to be individualized. I think the first thing to say is there needs to be a very robust and transparent legal, ethical, and financial background to underpin organ donation transplantation, whether it's definitions of death and so on. That's got to be up there, have public support, and supported by legislation. I think the second thing is to focus on staff, and organ donation fails at certainly in the UK, at all levels, from ITU staff to patient support groups. I'll come back to that. ITU, certainly in the UK, are very understaffed and overworked. Organ donation is additional work, additional costs, additional pressures, and by and large, those facilitating organ donation are not those who see the enormous benefit it brings to patients and their families. So I think you've got to target ITU doctors and nurses and other healthcare professionals. You've got and get them involved. In the UK, we found it really helpful to have specialist nurses in organ donation, and they are far more effective in ensuring consent than doctors. Although doctors think they're better, the data shows quite clearly they're not. The third thing I would say is to emphasize further the benefits to patients and their families for organ donation. There is a lot of anecdotal evidence, very little robust data, that those families that agree to donation and where donation occurs have a far better post-donation outcome. There's less depression, less upset, and the sense of pride that they feel. And all of us who've attended and met with donor families, it's really, I was quite cynical to start with, but they really are very impressive, the benefit. And I think people need to emphasize that organ donation benefits the family of the donor as well as the family of the recipients. Just a word on opt-out, opt-in. The UK several years ago moved from a opt